As a patient, you might feel helpless and at significant increased risk of getting C. difficile infection, feeling that the healthcare industry does not have a lot to offer to prevent this infection from occurring. So, one thought might occur to you that perhaps if we gave you an antibiotic that treats C. difficile in advance of getting it, or to prevent a recurrence in the future, we might be able to avoid the recurrence or the initial infection in the first place. This is a somewhat controversial topic because an interesting study from about 25 years ago looked at a group of individuals that had C. difficile in their system but did not have the active infection. That is the so-called carrier state. Gave a group of those individuals placebo and a group of those individuals vancomycin. And then they checked their stool 3 months later. It turns out that the group that received placebo remained positive for C. difficile about 11% of the time, whereas the group that received vancomycin remained positive for C. difficile 67% of the time. This is somewhat counterintuitive because one would assume that the group that received vancomycin would be more likely to get rid of the C. difficile because the vancomycin should help wipe it out. In reality, though, we believe that the microbiome, the bacteria, viruses, fungi, archaea that are living within our digestive tract are actually most important in fully eradicating C. difficile from our system. Therefore, within that previous study, it was believed that the vancomycin itself altered the microbiota and the microbiome, thereby weakening the body's ability to get rid of the C. difficile. And as a result of that, for many years, we've been avoiding giving vancomycin as a preventative measure. But at a major infectious disease conference that was conducted in October of 2019 in Washington, D.C., Nick Van Hise and his colleagues put this into question. Within this study, they created a scoring system to rate the risk of C. difficile infection within hospitalized patients. They included multiple risk factors that we frequently see for initial infection and recurrence, including a history within the previous year, a history in the distant past greater than a year, any system-wide antimicrobials, the length of hospitalization, any recent hospitalization independent of the current one, any acid suppressive therapy, among other factors. They said that if you had a score of 13 or above, you were at greatest risk for C. difficile infection. They looked historically at how this would work within their 400-bed hospital in Chicago, Illinois. And historically, the individuals that scored 13 or above within this scoring system had a rate of 88% that they got C. difficile infection, remarkably high. Then, in the year 2018, in hospitalized patients, they applied this scoring system, and any individual that scored 13 or above, they gave vancomycin 125 milligrams twice daily. Overall, they found a profound reduction in the rates of C. difficile. It decreased to 8%, which is a really significant decrease from the historical 88% that was recorded the year prior. So we can see from this study that in a very high-risk group, based upon the risk factors for initial infection and the risk factors for recurrence, individuals who are given low-dose vancomycin, 125 milligrams twice daily, are at significantly reduced risk of getting C. difficile, and vancomycin prophylaxis probably is a very effective method to reduce the risks of initial infection and recurrent infection in a high-risk cohort. Within my practice, I typically recommend that patients who have had C. difficile previously, who require system-wide antimicrobials for other indications, that they receive low-dose vancomycin 125 milligrams twice daily for the duration of the other antimicrobial. In your case, as a patient, you should always talk to your healthcare practitioner because there are multiple factors to be considered for each individual patient and each individual scenario. But this abstract brings up a really important concept that this might be an effective treatment for you.